Hi, my name is Andrew Nguyen, and I'm a veterinarian at Columbia Pike Animal Hospital and Emergency Center. And today, we are going to talk about cruciate ligament disease and the TPLO, which stands for Tibial Plateau Leveling Osteotomy. Cranial cruciate ligament disease in dogs are very common, especially in our large breed dogs. What happens is that there is a small ligament that lives deep inside that knee that helps with the stability of the joint. Once that knee is injured or that ligament is injured, the joint becomes very mobile and causes inflammation and inflammatory fluids to build up. This can happen in any breed dog, but again, especially in the large breed dogs. Typically, cruciate ligament injuries present as acute lameness on either the right or the left side, obviously depending on which leg is injured. So your veterinarian will see you and most likely do two tests on physical exam called the drawer test and the thrust test. Also, your veterinarian will want to take x-rays to look for radiographic evidence of the injury. The TPLO surgery is a unique surgery that involves physics to stabilize your knee. The goal of surgery is to keep that knee stable for long enough and pain-free for long enough that the knee actually solidifies down and scars and heals itself. This is our canine model of the canine stifle or knee. And if we flip our patella out of the way and look deep inside that knee, we're gonna see a ligament in there called the cranial cruciate, and it attaches to the front of the tibia and the back of the upper bone called the femur. What essentially that cruciate ligament is doing is that it's keeping this movement from happening. So with a nice strong cruciate ligament, there's no movement. When we tear it, we get slippage. And that causes inflammation, pain, and we want to repair that. If you take a close look, you'll see that the tibia plateau, or the top of the tibia, is slightly angled backwards. So when our femur comes down on it, it slips off the back without that cruciate ligament. Okay, that's the motion. So what we do in our TPLO is that for the lower bone, we make a semicircular cut, rotate the upper piece, plate, and allow that bone to heal. Now, that allows the upper plateau or surface to be nice and flat, so that when our upper bone comes back down on it, it hits it and it has nowhere to go. So we're using a bit of physics to keep it stable. And that's it, that's your TPLO. A TPLO surgery is a major orthopedic surgery, and it can be very concerning for clients to consider this surgery. I will say that Columbia Pike has staff trained for anesthesia and pain and comfort. We have top-of-the-line equipment, and we ensure with everything that we have that your patient is safe. The great news about TPLO surgery is that we can get comfort back in roughly 2 to 4 weeks. Now, the full healing of that osteotomy site may not be complete until 5 to 6 months, but you're going to see most of your recovery in the first 2 to 3 months. Your dog should be able to return completely back to normal after recovery, assuming that we followed our post-op care instructions. At Columbia Pike, we have several options to treat cranial cruciate disease in our canine patients, including the TPLO. If you have any questions at all, please come down, schedule an appointment, and see me.